So I think the most important data that we have recently also were presented in World Lung Cancer Conference, where the data regarding to a new inhibitor for RET-fusions and some mutations as well, of specifically this pathway is activated in several tumors, across several tumors. We presented the data from lung cancer specifically, and the response rate were very impressive, 68% of response rate with a duration of response of 23 months. So this data represent a very important step forward for these patients with RET fusions. The trial is still open, so we are enrolling patients also with mutations and fusions. So mutations are more common in other kind of tumors like thyroid carcinoma. And in lung cancer, it's very important that the fusions, the partner of different fusions, were able to have a response regardless to the kind of partner. So we can detect these fusions with different technologies. Tissue and liquid biopsies are accessible for these technologies. And I think it's more important, the message that I would like to leave is we need to test these patients and in order to find the patients that are able to respond to this drug. So 68% is very important because the population that we presented in World Lung Cancer were also patients that were receiving chemotherapy and immunotherapy before in some of the cases. So please test your patients because we need to increase the number of patients who can benefit from these kind of drugs.